Have you ever seen a mother pushing two newborn babies in one of those huge strollers and wondered how does she do it? Have you ever seen a pregnant woman with a belly so enormous you wonder how does she get herself through the day? Have you ever wondered about the safety concerns for the mother and the babies? Today we will be discussing twins and the risks for the embryo and mother during pregnancy. If you know or will know someone pregnant with twins, you will want this useful information to aid in a healthy pregnancy. Cassie and I are finishing up our studies in anatomy, and we have extensively researched this topic of twins. I have successfully achieved 4 pregnancies. Today we are going to talk about the different types of twins, risk factors for baby in utero, and the risk factors for the mother as well.
Let's get started. To start off, we are going to briefly discuss the types of twins there are. There are 2 main types of twins that we need to know: fraternal twins and identical twins. Now, fraternal twins are also known as dizygotic twins. This is because there are 2 separate eggs that are each fertilized by 2 separate sperms. This usually means that each twin is going to receive blood flow and nutrients from mom by their own individual placentas, as well as have their own amniotic sacs. The next type of twin is the usual type of twins that we automatically think of: identical twins. These twins are also known as monozygotic twins. These twins come from 1 egg and sperm that has split randomly and created 2 fetuses. Most identical twins come with more risk factors on top of all the other ones that come with being a twin already, and we are going to be talking about these risk factors next. The type of risk that happens to twins in utero that we are going to be discussing are the ones listed below. First, we are going to discuss the risk based on the type of identical twins that will then lead us to discussion of twin-to-twin transfusion. After, we will talk about the types of conjoined twins and then vanishing twin syndrome. There are 3 types of identical twins, and their names give you a clue to each type. First is dichorionic diamniotic twins. In each word you noticed di, which means 2. The word chorionic is relating to the placenta and amniotic is relating to the amniotic sacs. So these twins have 2 placentas and 2 amniotic sacs. The second is monochorionic diamniotic twins. The only difference here is the word mono meaning 1. So these twins have 1 placenta and 2 amniotic sacs. The last is known as monochorionic monoamniotic twins. These are the ones that share a placenta and amniotic sac. As you go down the list, you are going to be seeing more risks such as TTTF, cord entanglement, and more, as well as your doctor wanting to monitor these babies more often. Speaking of TTTF, you're probably wondering what that is. It is twin-to-twin transfusion. TTTF is the imbalance of blood flow between monozygotic diamniotic twins. If there's an imbalance of blood flow going towards the twins, this can cause them to grow at different rates. There's no known cause for TTTF, and there is a lot of issues that can come from it. This is usually because one baby is receiving too much fluid while the other is receiving too little. The baby who is regaining excess fluid filters it out through urination that causes their amniotic sac to swell. This can squish the other twin who is already weak and is struggling. Complications that come with TTTF is preterm birth, hydrops, which is the swelling of one or both twins, death to one or both babies, or impaired brain development. There are 3 treatments, though, for TTTF. The first is reduction amniocentesis. This is where doctors go in and remove the excess amniotic fluid, but this procedure is usually one that has to happen multiple times so that there is no risk to the other baby. The second one is selective laser ablation. They take a laser and sever the blood vessel that is going between both amniotic sacs so that the weaker baby stops losing amniotic fluid. The last procedure is selective cord coagulation. This is usually done last case scenario when they know one of the babies isn't going to make it, and because they're going to sever one of the baby's umbilical cords. These are all the treatments for TTTF. The next thing we are going to talk about is the types of conjoined twins. Conjoined twins happen because after one of the eggs and sperm fertilize, they start to separate but never fully do. There are 5 types of conjoined twins. First is thoracopagus, which these twins share a heart, liver, and intestines. The second is omphallopagus. They share a liver, biliary tree, and intestines. The third is pygopagus. These conjoined twins share spine, rectum, and genitourinary tract. The fourth type is ichthyopagus. These conjoined twins share the pelvis, liver, intestines, and genitourinary tract. Last but not least, the craniopagus conjoined twins. These are the ones that share brain and meninges. The last part we are going to be discussing when it comes to the risk factors for twins in utero is vanishing twin syndrome. Usually the mother goes into her first appointment and they detect 2 fetuses and hear 2 heartbeats. At the next appointment, the doctors can only see 1 fetus and hear 1 heartbeat. Another way that they can discover this is by analyzing the placenta. They can find abnormal chromosomes there next to the perfectly healthy baby's chromosomes. That raises the question, what happened to the other baby? They don't know. This usually occurs in 20 to 30% of multi-fetus pregnancies, and the cause is unknown. Sadly, there is no treatment for vanishing twin syndrome, but there are no risks to the mom and baby if this happens in the first trimester. If this occurs during the second or third trimester, the surviving fetus has higher risk of developing more issues and a higher risk of having cerebral palsy as well.
Now that we have discussed types of twins and pregnancy, we are going to talk about the risks for the embryo and mother. Risk factors are not just for baby, they are for mom too. Being pregnant with more than one baby is exciting. It is often a happy event for couples, but multiple pregnancy has a higher risk for complications. We are going to discuss a few of them, namely preterm labor and birth, birth defects, cord entanglement, and cesarean section delivery. More than 3 in 5 twins are born premature, before 37 weeks. Premature babies are born before their bodies and organ systems have fully matured. These babies are often small with low birth weights. This means less than 5.5 pounds. They may need help breathing, eating, fighting infection, and staying warm. Very premature babies are those born before 28 weeks. They are especially vulnerable. Many of their organs may not be ready for life outside the mother's uterus and may be too immature to work well. Many multiple birth babies will need care in a neonatal intensive care unit. Multiple birth babies have about twice the risk factor for problems present at birth, such as spina bifida and other neural tube defects and problems of the digestive tract and heart. The umbilical cord for the twins that share amniotic sac can become tangled up. In these cases, the fetuses may need to be monitored often in the 3rd trimester. Last, abnormal fetal positions raise the chance of a C-section. Today we have talked about the types of twins, the pregnancy of the mother, and some risks for the embryo and mother involved. Here's the bottom line to all of this. Twin babies are a ton of work, but they are really cute. We need to be aware of the pregnancies and different risks so we can support those expectant mothers.
Now please enjoy this next video that me and Leanne could not stop laughing at. Thanks for watching.